Hello, I'd like to welcome everyone to my presentation of response to intervention in special education. This is for CED 637. If you have any questions or comments as I go along in the presentation, you're more than welcome to ask them. Okay? All right. I don't know if you know this or not, but special education students are transferred to a county office of education if they are deemed too problematic for their school. And so where this study takes place is at a county office of education in Northern California. According to response to intervention, teachers and paraprofessionals have to implement academic and behavioral supports for students within the classroom environment. The goal of this study is to explore teacher and paraprofessional views on the effectiveness of positive reinforcement upon classroom behavior. So whether or not, rewarding students for positive behavior or acknowledging their positive behavior brings about a behavioral change, changes the behavior outcome. Classrooms consist of 12 high school students who all qualify for special education services by either ED or LD, ED being emotionally disturbed, LD being learning disabled. And I'm sweating. Okay, table of contents. So the things that we're going to go through throughout this presentation are the introduction, the review of the literature, research design, data analysis, and summary and conclusions. So, out of the Individuals with Disabilities Improvement Act of 2004 came RTI. RTI is the response to intervention model, and I'll show you an example of that model a little later on in our presentation. So this is the RTI model. It's a little blurry on here, but what this model basically says is that 80% of all students fall within this, on a behavioral scale, fall into being redirected, so to speak. If a student is acting up in class, then you can say, hey, can you please stop? And the student will respond positively, okay? 15% of those students fall into what we call our second tier, tier 2, which is you need more frequent progress monitoring as far as their behaviors go. And then tier 3, which is where we're at with special education and the students that I serve, or the students that are involved in this study. Usually about 5 to 10% of your student population will fall into this category. And they have more intensive services such as behavior support plans, assessments, things of that nature, FBAs, which is functional behavior analysis. So although IDEA, whatever, Individuals with Disabilities Improvement Act was focused on general education, the model can still be used in the special education environment as well. Okay. So given the relative newness of RTI, there's limited research on the effectiveness of applied RTI interventions, which include, yes, positive reinforcement.
When did the RTI go into place?
It went into place in 2000. It was actually I don't know, recommissioned or brought back in 2004. It was part of Bush's
No Child Left Behind.
No Child Left Behind. It's part of the NCLB. Yeah, it's part of that act. So that's when it took place. So positive reinforcement was seen as one of the evidence-based practices that can be used in implementing positive changes in behavior. So the reason I did this study is because research is limited in regards to effective classroom management. And a lot of teachers leave the field because of a lack of experience when dealing with difficult students. And so this study is basically to help them out and to see what kind of consensus we have amongst professionals that are implementing this RTI within the classroom. So, like I just said, this is an exploration of special educators' views on the effectiveness of these interventions. One of the key questions is, will they share the same opinions, the same perceptions, the same, about the effectiveness of positive reinforcement? And what is positive reinforcement? Okay, I'll answer that question too. So a token, activity, or social verbalization and or object valued by the student and given following a desirable behavior. So if you want the student to raise their hand before speaking, you say, thank you for raising your hand before speaking. And then you can, thank you is a verbalization, but we also have different systems that we use, token systems, such as positive tickets you can give out, which they can use in a student store, so to speak. So we have a lot of different ways that we can use positive reinforcement. Purpose. The purpose of the study is to, once again, explore the consensus between educational staff, a teacher, and a paraprofessional within one single classroom involving 12 students. So the significance of it is I'd like it to be used for additional training, professional development on the incorporation of RTI strategies, and the understanding by school personnel who are supposed to be implementing these strategies. Our research question is there any difference between credentialed and non-credentialed educational staff? So the credentialed staff is the teacher, the non-credentialed staff is the paraprofessional who works alongside the teacher. In this self-contained classroom, and their perceptions regarding the effectiveness of RTI and an IEP, which is Individual Education Plan, positive reinforcement behavior support. Upon decreasing on-campus, so the things that we'll be looking at are on-campus referrals, suspensions, on-campus suspensions, and off-campus suspensions. So this is where the data comes in.
So you're going to do this research in your classroom, and you're going to see if it works by looking at the suspension rates and the behavior. And,
So I do what I do is a comparison. I'll show you as we go along, but there's a comparison between the data and the perceptions of the teacher and the paraprofessional that are working in the classroom, and you'll see the either the consensus or the difference. Okay. So the assumption is that participants are knowledgeable of RTI principles, meaning that the teacher and paraprofessional know what positive reinforcement is, and they're also knowledgeable of IEP accommodations and modifications, and that they answered these as honestly as possible. Some of the delimitations are responses are descriptive in nature and can't be generalized to other settings. So this is one setting, special education class, self-contained classroom, 12 students. So I don't know how this study would translate to other areas, and we'll talk about that later as well. And then the lack of
anonymity.
There it is, in respondents' identity, because I know the respondents are colleagues of mine, so that's another delimitation. So, due to the significance of behavior problems occurring within the classroom, causing teachers as well as other school staff to address them, is reason to implement a positive behavior system within the classroom. Okay. The RTI model acknowledges the need for behavior support in the classroom. So chapter 2 literature review. So I'm gonna be going through a list of quotes by research that I've done and some of the researchers that have come up with answers to some of the questions that I had in the study. So Mary Little said that with its origins in special education, RTI is a systematic, data-based method for identifying, defining, and resolving students' academic or behavioral difficulties that rely on collaborative, school-wide problem-solving approach. So when we look at that, it's not one person making that decision as to what's going to work within that classroom or for that particular student. When we get together and we talk about these things, there's a school psychologist, there's a teacher, there's the paraprofessional, there's the principal, there's the program specialist. There's a group of people who collaborate on what is going to work not only for the individual but for the classroom, and then we look at school-wide as well. So also in the literature review, we see that a loss of instructional time, feelings of inadequacy, and stress are some of the many shortcomings of poor classroom management. And as I stated earlier, a lot of teachers leave the field, especially in special education, because of the lack of classroom management skills.
And they just don't feel they're effective.
Yeah, they don't feel they're effective, and the students are difficult, to say the least. They're difficult. So in the special education classrooms, teachers often have improving a student's behavior as their primary goal. So we're not even talking about academics yet. You know, a lot of the students come, behind, 2, 3 grade levels behind in learning in these situations. But still, their primary goal is to get them to sit in their seat for 50 minutes without causing a disruption.
Just working on behavior alone.
Yeah, just working on behavior alone. So previous approaches to addressing classroom and behavior management have often involved a reactive approach to behavior. So say Lynn acts up in class and I say, Lynn, you have to go to the principal's office. But we already know Lynn has certain behaviors in the classroom that we need to address. So why not take a proactive approach and meet Lynn at the door and say, hey, Lynn, these are some of the things that we'd like you to work on today before you get into the classroom, so that you think about it. And then hopefully we don't have to send you out to the principal's office. That's one of the things, that's more of a proactive approach versus a reactive approach. So Oliver and Reshley summarize early intervention and treatment is essential for students who are emotionally disabled in order to prevent more serious maladaptive behavior. So we want to get to them early. A lot of students are being identified earlier and earlier for special education. We're talking kindergarten, first grade, second grade. If we can wrap some services around them before they get to the high school level, junior high, high school level, then maybe we can get them out of special education altogether. Oliver and Reshley also found in the research on students with behavioral disorders that teachers who effectively managed their classroom focused on prevention rather than reactive approaches. And they explicitly taught the desired behaviors. So if I don't want Lynn to speak out of turn, I'm going to say, hey, Lynn, can I have your recess time so that we can work on raising our hands? And I'm going to teach you how to raise your hand, okay? And I'm going to give you a proper response, okay? And then we're going to reverse roles. And I'm going to raise my hand and you be the teacher. And how do you respond to me? So that we're explicitly teaching these behaviors that we want.
As simple as they sound.
Yes.
I know.
Yeah. But the lack of skills that special education students come to school with is evident, and so you have to like it says there, explicitly teach it.
You
So,
can't make any assumptions about what they know or don't know how to do.
and you don't, know how many times teachers have said they should know that, they should do that.
And that's a common statement that comes out of teachers' mouths.
Mm-hmm.
I can't believe they got to me without knowing this already, that somehow someone else should have talked to them.
So like I was saying, tier one, in our RTI model, tier one is the foundation of the model. It consists of scientific, evidence-based, core instructional and behavioral methodologies. So one of the things that a teacher told me, that the best thing for behavior management is the curriculum, is the teacher. If you can make curriculum exciting and you can make it interesting for students, then you'll have less behavioral issues. So, if you get these evidence-based core instructional methodologies and you apply them within the classroom, but spice it up a little bit so that students are interested in it, then you're more than likely to have positive student behavior. All right, so tier two. So when we look at tier two in our RTI model, so we're looking at specific strategies for conveying the behavior curriculum to students. That should include positive reinforcement systems, token economies, rule checklists, behavior contracts. We recently did a behavior contract for a student who was working on inappropriate language in the classroom. And the way that it worked is this student was getting probably 3 to 4 referrals per day, discipline referrals regarding his inappropriate language. So I sat down with him and talked to him about creating a contract. So in that contract, if he got 1 referral or less for, 3 days, then he will be rewarded with a Chipotle burrito. That's what he wanted,
Did it
So
work?
it worked. So that's a very small window, 3 days. You generally need 3 weeks to bring about change in behavior.
What you nudged him for?
I don't mean to put you to sleep, man.
Do not close your
Do I
eyes.
get to blink?
Barely.
Like I have an attitude policy?
Yeah.
So, but he responded positively to it. And those are the things that we bring in. That's a tier 2 intervention. And like I said, tier 3 is that next level. And it's for students with severe chronic behavioral needs and may include instructional practices, strategies, and different special education programs. So the school that this study took place in is all special education. There are 100 students in the school, but we just talked about the 12 in this classroom. So it's geared towards students with chronic behavioral needs.
Tier 3 people.
Tier 3, the whole school.
You need to get some researchers whose names you can pronounce, though.
Yeah, did you see that?
Yeah.
Yeah, some tough ones in there. So once again, RTI provides a framework for educators to look to for answers when students are having difficulty academically and behaviorally. And these are just another example of that model there. Research question. This is chapter 3, research design, our research question. Is there any difference between credentialed and non-credentialed educational staff teaching in a special education classroom regarding the perceptions of effectiveness of positive reinforcement behavior support upon this decreasing of referrals and suspensions? We talked about the setting, we've talked about the participants already.
How old are these participants, these 12?
The 12 students range in age from, I can tell you grades, so they're basically 9th through 12th graders.
Okay.
9th through 12th graders that exist in one classroom, so that'll tell you a little bit about, the
Range.
different levels of what we're working with. So the teacher and paraprofessional were each given a survey to identify their perceptions on the effectiveness of positive reinforcement.
Should be interesting.
So SWIS, which is the school-wide information system, was used to provide the data on the school year of 2012-2013 regarding the referrals and the suspensions, as well as the reinforcement, the positive reinforcement within the classroom. Survey questions given to the teacher and paraprofessional. Answers were then compared to see if there was any difference in their perceptions. So the survey questions are, and they were basically answered yes or no to each question, and then I compared their answers and was able to see if there was a consensus and did some measurements between the two. So question number 1, has positive reinforcement been effective in reducing disciplinary referrals generated from the self-contained classroom as measured by SWIS? Okay. Question 2, has positive reinforcement been effective in reducing on-campus suspensions generated from the self-contained classroom as measured by SWIS? Do you know what the term self-contained classroom means?
No,
Okay.
I can make a guess.
Okay, let me explain that then. A self-contained classroom is where students are generally, even though they're in high school, they don't switch classrooms. They don't transition classrooms like a quote-unquote normal high school would do. So students stay in the same classroom for the entire, all day long.
Okay.
So, question 3, has positive reinforcement been effective in reducing off-campus suspensions? Question number 4, has positive reinforcement been effective in increasing positive behavior in the classroom? And question number 5, has positive reinforcement been effective in decreasing negative behavior in the classroom? And the last question, question 6, is has positive reinforcement helped in overall classroom management of student behavior?
I'll check them.
Okay. All right, chapter 4, we're almost through. Data analysis. Assumption made by the researcher was that the data collected and presented should show a consensus amongst the teacher and paraprofessional on the effects of positive reinforcement. Okay. What do you think? Do you think there was a consensus amongst the two?
You'd think they'd be both observing the same thing, but
Mhm.
if you're paraprofessionals, we're looking at the Swiss data.
Mm-hmm.
I mean, if you have the same results, you should be able to come up with the same conclusions, right? I mean, basically, aren't there conclusions not just visual, but also from the data?
Yeah,
Whether or
I
not
don't.
they were suspended or
I don't know whether or not they had access to the data or viewed the data. So it's basically
just what you're seeing.
what you're seeing.
Yeah.
What you're seeing.
They
How
could
many.
attribute it to different things though.
Right,
They don't necessarily have to attribute it to positive reinforcement.
Mm-hmm.
which is part of the perception you have to, right? Do they even
I'm
see it
gonna
as
guess
working?
that there's a difference.
You're gonna guess that there's a difference.
Oh, we're getting to guess that there's a
Yes.
difference between the,
Between the professionals
and
and the para,
yes, there's a difference.
There's a difference.
I bet the paraprofessionals see positive reinforcement in a better light.
I'm gonna guess that they both see the same results.
Okay.
What about you, Kara?
Difference.
So there was only a 50% agreement overall between the teacher and paraprofessional on the effectiveness of positive reinforcement, reducing the number of discipline referrals. There was also 75% agreement overall on the ineffectiveness of positive reinforcement in reducing the number of on and off-campus suspensions.
That's their perception. We're
That's
still
their-
waiting to
that's
see
that's
what
their
really
perception.
happened.
Data suggests there is a difference in the perceptions of positive reinforcements within the self-contained classroom amongst educational professionals and its effectiveness for the student population in
Who
this study.
saw it in a more positive light, the paraprofessionals or the, I have to wait?
Yeah,
Build
So,
up.
there's a Some of the limitations we talked about earlier is the small test sample of one teacher and one paraprofessional. Another being that there's only 12 students involved in the study, so it can't be.
Small sample size.
Yeah, a small sample size, can't be generalized to other settings. And the last limitation was the participants were colleagues of the researcher, so we hope that they answered the questions as honestly as possible. So, Chapter 5, summary. The data did not support the researcher's assumption that there will be no difference in perceptions amongst school professionals concerning positive reinforcement and its behavioral consequences. Data suggests that the perceptions of positive reinforcement amongst the paraprofessional and teacher are not the same, with them in agreement on 66% of a possible 36 answers.
Wow.
So there's a big discrepancy in what people are.
Perceived as effective in the classroom.
Yeah,
Wow.
yeah. And we'll talk about why that is too. I want you guys to think about that, why you think that is between the two. And I'll throw in my 2 cents as well. The findings of the project suggest the need for further research, and further research would allow for better understanding of the intended purposes of positive reinforcement as a behavioral strategy and its long-term effects for students in various educational settings, not just in the special education setting. So, questions, comments?
Well, it makes you want to go out and see if it's across the board. Do teachers who've been there longer have less faith in the positive reinforcement method because they've been there longer? Do the paraprofessionals have more faith in the positive reinforcement because they're in a different situation in the classroom? I don't know.
Yeah, one of the things that skews a lot of teachers' views when it comes to things like RTI and positive reinforcement is that they've kind of been there, done that. When you've been in teaching a long time, you see the government rolls out new programs every 2 years, every 3 years, and they're like, oh, what do we have now? What's next? What's this? What's that? What I think is different about RTI is that it's evidence-based. These are evidence-based practices that are put into these classroom settings. And
But even when you show these guys, these two professionals, the evidence, I mean, did you, at the end of all of this, and have they seen these results?
Yes, they have. And what they think is that the students, the 12 students that are involved in the study would act the way they acted no matter what.
You
know,
don't have
and
like a sample.
Yeah, and that for some of them, yeah, they did respond well. But they were
responded well regardless.
Yeah, they would have responded well regardless. Exactly. So they don't think that positive reinforcement per se was the, how do I say that? The
guiding force and changing their behavior.
The antecedent.
Right.
Mm-hmm.
Right.
Well, I think the other issue is that there's no silver bullet for behavior. Behavior is a function of so many different things, and given the student, each student is going to be different. And I think that sometimes, as somebody who's a counselor, I want a silver bullet. I want that thing that I can know how to do, that every student that's going to come in contact with me, I'm going to be able to affect positive change. That's not always the case. So that can muddy the perception of it as well, I think.
Mm-hmm. Yeah, and I think that the teacher and the paraprofessional also have different levels of understanding of RTI and positive reinforcement systems, and so that difference in knowledge can sometimes skew your perception as to
It's not working.
yeah,
Maybe they're not even using it.
yeah, it's not working, or they're not using it effectively. When in fact, by the time these students get to high school, they've probably been in special education programs all along, and so you get to see,
I got it.
you get to see the students grow in these different areas. And so what may not look like a whole lot to one person, looks like a dramatic change to someone else. So, just seeing the whole picture.
I think that just being so close to the situation, you know, the instructors that have been with these kids for a long time, and then even if these paraprofessionals are relatively new or whatever, you know, they're in the classroom, they're seeing these people all the time and so on. I think perhaps, you know, an unbiased observer, you know, might be a good way to kind of, you know, observe, you know, physically what's going on in the classroom. Somebody that's, you know, not in the classroom all the time, but is in there, you know, pieces or whatever, gathering the information and being able to analyze without having that intimacy of being, you know, with the class, you know, regularly, might clean up the results just a little bit, or the statistics just a little bit. And without question, the sample size is just way too small. I mean, you could, when you only have a sample size of 12, you could go, you know, off completely in one direction or off completely in another direction.
Very
So,
true.
yeah.
Very true. Which is one of the implications for further research.
Yeah, sure. But I think if the techniques were developed so that you could have the same, you know, experimental research being done in a number of different classrooms, then you can gather some more data, and your numbers are going to be more reliable in terms of your effectiveness. There's a problem with, I think, you know, instructors that have been with these kids for a long time, or paraprofessionals that have been with them, even if they've been with them for weeks or months or whatever, they're jaded, they're prejudiced already, you know. Billy's never gonna be able, never gonna respond, you know, and Janie's never gonna do this or that or whatever. And so no matter what they see, you know, they might not give you the, you know, the answers that are honest to them and correct, so.
Yeah.
So I guess the conversation about the silver bullet, because maybe that's part of the problem too. Maybe we need to stop looking for a single thing, which is very hard for us. It's what we want.
Yeah.
Make it easier if we could find one thing.
Yeah, well, thank you guys for listening, I appreciate it.
No, very.
And that's.
It's all about honey versus vinegar, right? So,
Yeah.
Plus, I would think positive reinforcement sounds good to me. I kind of like it.
classic.
I would prefer it
Yeah.
in my life.
Yeah.
I mean,
I mean, that's how we are. I mean, we are rewarded. Your paycheck,
Mhm.
that's positive reinforcement. Keeps you
Done.
going.
right?
Yeah.
I know.
You know, 'cause I mean, folks are rewarded that way, you know. And also when students, I mean, you get positive reinforcement in a number of different ways, but students who come back and say, you know, you've been a great professor, or you've been a great role
I
model
think
in my life.
that's the bigger
I mean,
deal.
that's,
I think that's the bigger deal than the paycheck.
yeah,
I
no
mean, the
doubt.
paycheck's nice, but ultimately,
We can get a paycheck in other
yeah,
ways.
and I just feel like special education or not, everyone wants to feel fulfilled or, you know,
That they're doing something to change
deeper.
the world. That
Yeah.
they're actually actively participating in some bigger experiment.
Or maybe we just think that.
Or maybe we just want to believe we're actively participating. You
Kept
did an
us-
excellent
Kept
job.
us going for a long
Thank
time. So. Good.